Hi, I'm Kathy. I'm going to talk to you a little bit about baby care today. Probably the biggest thing that parents would ask about would be diaper changes and a bath. So I'm going to undress baby. One of the tips I want to let you know, though, is that if your baby's clothes has this this style of top, you can take the top and fold it out like this, and then you can undress baby downward, which is a really nice option to have if baby has a blowout and you don't have to take that shirt up over their head. But it can also be helpful because sometimes wrestling with their getting it on over their head, it is easier to go up. So you could just roll it out like this and slide it on up that way too if you were dressing baby. So once you get baby's clothes, I'm going to go ahead and do the diaper change first, and then we'll go into the bath. So we're just going to use a washcloth today, but if you've got your wipes there, you're going to open up baby's diaper. With little boys, you always want to be careful that you cover him as quickly as possible. You're much more likely to get peed on with a baby boy. Baby girls can pee on you too, but much more often with a baby boy. So get your wipe ready and have it ready to drop on top as you're changing him. Take your baby wipe, make sure you wipe all around like the scrotum, the penis, all under there. Taking a clean area every time you get some poop on it. So use as many wipes as necessary, and then you're going to wipe downward. With a little girl, you're always going to wipe from front to back so that you're not getting any stool in the vaginal area. And then, have that clean diaper ready to tuck underneath. If you use any ointments, you're going to go ahead and do that. With your baby boys, if you have circumcision care, you would be doing your Vaseline and gauze on top of that. And your nurses will talk to you about that before discharge, and you'll be comfortable with that. And then you're going to put your diaper on. With newborns especially, you may need to cross those tabs over. These diapers can be pretty, looks like my diaper's ripped, pretty big on your newborns. So you're going to go ahead and pull it, and if you have to cross them, just to make sure that you don't have a big gap here. These are fairly elastic, so you'll notice you can make them pretty tight, and you'll still be able to get your finger in there. And then we'll talk about a bath. So when you're going to bathe your baby, you're going to find a non-drafty area. It might be your bathroom sink, it might be your kitchen sink area. You might have a bath like this. So this is like a nice option. It's got this netted area, so you could just put baby on here and then just wash them here, and then that grows with baby. But if you're just going to use right near your sink, you're going to place baby, I would use like a blanket or a towel, and you're going to start at the top and work your way down, kind of. You're going to start with their face. So no soap on baby's face. You're just going to use a wet washcloth, and you're going to start at the inner eye and wipe out, likewise on the other side, and then just wash their face. I would just, wipe that down with water and then dry them. If you're going to wash their hair, you're just going to support them here. Your baby doesn't need a bath every day. It does dry their skin, so even once or twice a week is more than enough for that, because you're going to be washing their changing their diapers, washing their private area with every diaper change. So if you're going to wash their hair, you're going to run the water over their head, and then you're going to you start with their arms. Wash and then rinse this arm, and then you're going to take your towel, you probably have more than one, and dry their arm off. Likewise with this one, make sure you kind of get in the little folds, and in their hands, a lot of times they'll because they fist their hands a lot, they'll end up with a little lint in their hands, so make sure you get in those creases. And it's fine to just use water on their hands as well. And then their chest, wash and rinse. Their back, wash and rinse. And then I would usually say that if they've got a diaper on, leave it while you're doing the sponge bath. You're going to just leave the diaper area covered, wash their legs first, and then do the diaper area. They're going to get a sponge bath only, so you're not going to submerge them in one of those little tubs until their umbilical cord is healed, and if you have a baby boy and you had him circumcised, until the circumcision is healed. Circumcision is an elective procedure, so I would talk to your OB about it, or do some research and make your decision on that. Some of the things you might see with babies, things that we call a normal. Babies sometimes get what we call a newborn rash. It looks like new baby acne. That goes away on its own. There's nothing special we need to do for that. They have, sometimes they'll have birthmarks. They might have, some babies will have a Mongolian spot. That's like a gray area. A lot of times it's near the bottom of their back there. Thing that's common with babies after birth is they may get jaundice. Jaundice is when their skin gets a little bit yellow. So your pediatrician would be monitoring baby for that. That's a level we check on babies every 24 hours. Safe sleep is something else I always like to talk to you about. Babies should always have their own sleep space. So rooming in or having babies sleep in the room with you is always a good idea. It's recommended for up to 6 months by the American Academy of Pediatrics. And babies should always be placed on their back in the crib. When you put baby in the crib, you're going to either have a sleep sack, which is one of your best options, or you're going to have a swaddle that you have purchased, one of those pre-swaddle things. Those are some of the best things. Here in the hospital right now, we still swaddle babies with a blanket, and so that might be something you do here in the hospital. So you're going to spread your blanket out. You're going to just fold down the top corner, line it up with baby's shoulders, and then you're going to wrap this way, and this baby's a little hard. Tuck it under the side there, bring this corner up this way, and then bring this one around and wrap it. So having a pre-swaddle is a nice idea, but one-piece sleeper, sleep sacks, what's the other one I'm thinking of? Like a pajama, a fleece sleeper as well. Those are things that are considered safe for sleeping. No loose things in the crib. So you're going to have a fitted crib sheet, no stuffed animals, nothing else in the crib with baby. And always on their back to sleep. Then, if you have to take your baby's temperature, pretty easy to do. Little digital thermometer like this is really all that you need. Turn it on, and tucking it under baby's arm this way, right under their arm is the best way, or you could also lay it lengthwise under their arm this way. Sometimes the pediatrician might ask you, not often, but to get a rectal temperature, in which case you would take just the very end of this. Usually the easiest way to do this with baby is to just pick their feet up this way, and as if you were doing a diaper change, hold the thermometer and just insert a little ways in, kind of a little bit past that, past the metal part there, and do it that way. But mostly your pediatrician will ask, it's okay to do the axillary or under the arm. Okay. All right. Put this diaper back on. We'll dress our baby. If you're breastfeeding, take the breastfeeding class. And we'll talk right now about if you had to either supplement your baby with some breast milk, if you were just pumping, or if you had to formula feed your baby. There's either breast milk or formula in this bottle. One of the best ways, particularly in the first couple days, to feed your baby is to actually put them in a seated position on your lap or on a surface. You'll see us do it like in their cribs a lot of times, if baby's in the room with you. Holding a baby behind the ears, hands between the shoulder blades like this, so that their chin is up a little bit, and then hold the bottle. You never want to hold the bottle completely vertical. A little bit more horizontal so that the formula or breast milk is in there, and then pausing them frequently. Once you're done with that, you can, about every 10 to 15 mLs, you're going to burp your baby. So you either put them up on your shoulder, and I'm sorry, this baby is so easy to hold incorrectly, but like this, or on your lap. You can hold baby and support babies along the chest here, lean them forward and right on the cheekbones, and then burp that way. This is one of the best ways and most common ways you'll see us do burping here in the hospital. In the first couple of days when the baby's here in the hospital, you will see us, you'll see the bulb syringe. The bulb syringe you definitely don't want to overuse, so you would really only use that if baby spits up and they seem to maybe have a little bit in their mouth they haven't cleared. As long as their color is good, they're breathing okay, we don't want to get too carried away with this. If their nose sounds a little stuffy but you don't really see anything in their nose, you don't just want to blindly sweep. But if you had to suction your baby, you would always clear their mouth first, and then you would clear their nose. Depress the bulb syringe, suction it like that, then you can just squirt it out like that, and then you would do their nose. Okay? If we do suction baby too much, the mucous membranes in their nose are very sensitive, and it can actually cause swelling, and it makes them actually more stuffy.